we need to continue doing exactly what we've been taught to do, continue with social distancing, continue washing your hands, and continue sanitizing our hands, because we don't want to go back to level 5 for a very lot of reasons. Because if we did, I mean, the economy suffers and it gets closed. And COVID does have a lot of sort of healthcare wise, and then people losing their jobs and people dying and so forth. So we don't want to go back to the same issues that we've dealt with. If ever there was a second wave, we want to handle it much better than we did before. Initially, when this hit, elective surgeries were cancelled, and then we did see that in our emergency departments, things were closed now. I mean, the beds were empty. But before COVID, we knew very well that we have patients with diabetes, with a lot of things, strokes and heart attacks, that were not there anymore. And now the question was, where are they and who's looking after them? Because they didn't have access to healthcare. They were out there somewhere. So we don't want that. If we get to the second wave, we don't want those clinics, those elective surgeries to be closed. Although we were anxious and stuff, but we were led, and we learned that we could adapt. Initially, it was very, like in medicine, you are always taught that this is how we do things and it's never gonna change. You can ask, okay, can't we change this because it's really not working anymore, but nothing. But then during COVID, things changed, and quite rapidly. People went into meetings and 6 hours later came and said, okay, we have changed this. You can use that space, and all of that stuff. And then the other issue that I took was overcrowding, especially in the emergency centers. So, which is very multifactorial. There's always people there with backaches that shouldn't be there. And then sometimes there was like visitors that are just causing, and there's always been a debate, should we have visitors in the emergency center? And then it worked for me. I loved it, because all of a sudden people were not allowed to be in the emergency center as the visitors. So I liked that. Even though we couldn't do that before, now we felt empowered that actually we can. And it really does improve things, and I think it's one of those things that doesn't have to go away. What also made it very nice is we had some kind of intersectoral collaboration, where we had people, it wasn't just healthcare workers as advocates of healthcare, but people from entertainment as well, security, police, all of that stuff. We had people in sports coming on TV to tell people to wear masks and sanitize. So now, and people, like normal people in the public, using words like comorbidities that they've never had before. So everybody was involved. That was very nice.